Hello, everybody. I hope that you all are well and blessed today and highly favored. Welcome to Diaspora TV. This month is Black History Month. So we're celebrating all of our ancestors and everybody who's made a difference. And today I'm privileged and blessed today to talk to Dr. SERGE Alexandri, who I had the privilege and blessing of working with through the HIV program at the health department in Delray Beach. And he's here with me today as my special guest, and he is Black History. So today we're going to talk about HIV slash AIDS, because they're two different things, and we're going to talk about diabetes. So we would like to welcome Dr. Alexandri here today. Thank you for coming out today. I appreciate you. You look the same. A brilliant doctor, everybody. Absolutely brilliant.
Thank you for having me. How you doing? I've been here for such a long time.
I miss you too. We had some good times
yes,
here.
Yes, we did.
Making a difference in our community.
Okay.
Yeah. So the first thing I want to start out is, how long have you been a doctor?
Well, I graduated medical school in 1983. And subsequently I did 6 years residency. I did residency in internal medicine. Subsequently I did fellowship in geriatric medicine at Winthrop University Hospital, and I did a fellowship in HIV medicine at the University of Miami, Miller School of Medicine, Miami. So together, between starting medical school, finished in practicing roughly 40 years, from between medical school training and practicing. I've been practicing for over 25 years. So therefore, together, from medical school training, year of experience in practicing, that's about roughly 40 years.
Y'all hear that? 40 years roughly.
40
years.
From medical school to where I am now.
To where he is now. Amazing.
Yes.
Amazing. And when I tell you guys that he's a brilliant doctor, believe me, he would come there and all the patients wanted to see him. It didn't matter what creed, color, race they were. He's an excellent doctor. He took the time out with each patient. You know, sometimes you go in 15 minutes tops, but he spent time with these patients. He went over their blood work. He explained everything. Now, we work, as I said before, we work together in HIV.
HIV clinic, yes.
So, would you explain the difference between HIV and AIDS?
Okay. Basically, HIV is when you are infected with the viruses. You have HIV. That's when you've been infected. So it might take you more than maybe 10 years before become AIDS, depending on many factors. Now, there are two ways you can describe HIV positive. HIV disease. Number one, you can be infected with HIV. That doesn't mean you have AIDS. However, if your CD4 count is below 200 by CDC criteria, you have AIDS. Below 200 in your CD4 count, below 200, and I can explain why. The other way you can explain AIDS is when you're HIV positive, then subsequently you become sick as a result of the HIV infection. So therefore we call it AIDS. For instance, certain type of pneumonia, meningitis, whatever the case might be, if you're HIV positive and you have certain type of disease that associate with it, so we call that AIDS. So meaning that you can be HIV positive and live years without becoming AIDS, because we do have what you call people with HIV positive. They can last 20 years without any symptom, never become AIDS. So it's very difficult for people to understand that just because you're HIV doesn't mean that you have AIDS. Not at all. But if you're HIV, you're at risk to have AIDS. You see what I'm saying? Right. Depends. You may have subsequent. If you live longer, you may have AIDS. So that doesn't mean because you HIV today, then you're gonna die from HIV. In fact, people don't die from HIV anymore, AIDS anymore. They die for other complications. For instance, we do have children in Africa, even here, born with HIV and able to graduate college and get married.
Wow.
So HIV is not a death sentence. In fact, I can give you other diseases that even worse than HIV. For instance, if you went to a clinic and you diagnosed with pancreatic cancer, that will kill you in less than 5 years. Whereas you can be HIV positive, you live over 20 years.
Right.
So people believe that since I'm HIV, this is a death sentence, which that's not true at all. At all, at all. So we need to explain to the patient that if you're HIV positive, all you have to do is to listen to your doctor. Become like a partner with your doctor while taking your medicine. Once you take your medicine, that's your weapon. Can you go to war without your weapon? No, the answer is no. So your weapon is your medication. Once you take your medication, HIV, will be scared of you. Because we do have people who've been HIV for over. I remember when I used to work in the health department, about a few years, maybe almost 20 years ago, I saw a patient seeing me from the department. Patient I've been seen for over 20 years.
Yes, I had a patient.
You see what I'm saying?
That was 25 years. He was 25 years HIV positive.
I'm telling you. So therefore,
Yes.
HIV, people need to understand that if you become HIV, all you have to do, take your medication. This is the problem with HIV sometimes. Sometimes not everybody can tolerate the certain side effect of certain medication. If you're able to tolerate your medicine, trust me, you live a normal life. Normal life. And 5 years before, people used to take 15, 20 pills. Now you can take one shot every 2 months. You can take only one pill a day, that's it. So make it easy. Treatment of HIV have been so easy as compared to 20 years ago when I was in training. So people need to understand that. There are other things I'd like to discuss about HIV, which is very important. I remember when I was at the health department and we had a patient with HIV, that was the husband with HIV. The wife doesn't want him to touch anything in the house. If you want to eat, you eat separately, not next to me.
I'm so glad you brought that up.
Don't you know, if you like myself, I like to eat out. If you go to any restaurant in the United States, especially in Miami, do you know the plate they serve you? Do you know how many people been using that same plate, same knife, same spoon, yet they were HIV? People don't get HIV like this. This is what people need to understand. Because your husband's HIV, you said, this is I put your plate this side, your cup this side, don't touch my cup. That's not true at all. Because I myself I have patients with HIV with whom I'm seeing in a restaurant, and I sit down and eat my meat easily. In fact, I have a young lady she has HIV. She was my patient from her department. She came to my house to work for me. She cooked for me. Although I know she was HIV.
Right.
You don't get HIV like this. She cooked for me, she cleaned the house, I sit and eat her food. As we speak, she works at a restaurant. People don't get HIV like this. So it's a way to try to understand that HIV, you don't catch HIV just I'm using the same cup with you, the same thing. No.
Right.
How many times you been to a restaurant? Do you know how many HIV patients use the same spoon, same plate? 1,000. Yet you don't get HIV. So these things need to be explained to the public, for they can less
They can understand.
They can understand the nature of the disease.
Right, because that's what they used to say to me. Oh, you gonna get HIV by working there?
No.
I said I can't get HIV by hugging them.
No way.
You know yourself. I used to.
No. Unless of close contact, unless of sexual contact with them, otherwise you don't get HIV.
Exactly. That's what.
Even that you can protect yourself. Even that, because we do have disparity. Sometimes we have husband with HIV, a wife without HIV. We have them use condom. Use condom. That's not a death sentence.
Exactly.
Just because you HIV, that doesn't mean that you no longer have a sexual life. Not at all. Not at all. You can be sexually active, but with precaution.
Precautions. That's right. Yeah. So, thank you for that. I appreciate it.
All right.
So, could you explain what is viral load and what kind of tests do you have to measure the viral load? But tell us first, what is viral load? Please.
I'm glad you asked that question. That question is extremely important because I remember when I was a fellow at the University of Miami, I had a patient came to me say, Doctor, I'm good now. I can do whatever I want. I can have sex without condom. I'm free because doctor told me my viral load is undetectable. I said, really? That's not true at all. Even though if even though your viral load is undetectable, you can still transmit the disease to them. How do we measure a viral load? What is viral load?
It's viral load, yes. Answer
Okay.
that question for me first, please.
Viral load, when I was in training, when I was at Federal, 2001, 201. So we used to measure viral load 400, I would explain to you, 400 cells per milliliter of per cc of blood, you must say ml or cc of blood. Meaning that the when you take the microscope, you analyze the blood. If you see less than 400 cells, so you can say this is undetectable. Subsequently, it become 200, it become 50, 20, and less. Meaning that viral load is the amount of blood that you carry in your system.
Right.
See, and the amount of viruses that contain on each cc of blood. If I'm telling you, because our body, we have about 5 liters of blood, okay? 5 liters of blood totally. So if I'm telling you that your viral load is 1 million, that's been for every cc of blood, cc, milliliter of blood, you have 1 million virus. So if I said to you, now imagine if I said you have 1 million virus on every milliliter of blood, now just multiply one, we have 5 liters of blood, so 5 times 1 million, see how many virus that you have. Now, when we say HIV viral load, that doesn't mean, let me give you an example. If I'm inside a room, for instance, we are about 20 people in a small, tiny room, and I let the door semi-open, slightly open. If I'm going through, turn my head like this, I can see people, that's right?
Right.
If we are, let's say in this room where we are, we 50 together, right? We start 50 people. And the pot is half open. If I'm passing by, turn my head, I can see people. But if it's only 2 people, one at each corner, like this, like that, the door is open, I don't see anybody, undetectable, but there are people there. You see what I'm saying?
Right, exactly.
Undetectable means I don't see you. I cannot see you, but that doesn't mean you're not there. So even though you are undetectable, you are still, there's a possibility you can transmit the disease, however, it will be much less. Let me explain the viral load in the way for anybody can understand that. Let's say, for instance, if I have one tank, that tank contains with a capacity of 100,000 gallons of water. One tank with a capacity of 100,000 gallons of water, okay? Mm-hmm. And I said, Felicia, okay, you know what to do? And put 500 or 1,000 grain of rice on that tank. Turn it around. Give me a spoon of rice. Get me a spoon of rice. See, that tank contains the capacity for, let's say, 1 million gallons of water. And I drop 100,000 of grain of rice on it. And I said, give me 1 teaspoon of water. Your chance to get a grain of rice is high because the total is about 1 million gallons. And I put 500 grain of rice. If I turn around, I said, give me a spoon of water, I'm going to get, maybe I might get grain of rice. But if I put the same amount of water and I put 50 grain of rice, what's your chance to catch a grain of rice? As compared to 300 grain of rice. Now I put 50 grain of rice. Your chance is slim.
Exactly.
You follow what I'm saying?
I'm following what you're saying.
Can I repeat again? That's the tank of water. that's contain 1 million, no, a tank contain 1 million gallon of water. And I put 500 grain of rice on it, 500 grain of rice, and turn it, and now and I take 1 teaspoon of water. How much? What might change to get a grain of rice? Because there's 500 turn around. My change is maybe I can catch one, but if I put 20 grain of rice on that 500 gallon of water, my change to get, if I quickly I try to catch grain of rice, is going to be difficult.
Exactly.
Meaning that people with high viral load have a tendency to transmit the disease as compared to people with low viral load.
Right.
So if you're involved in sexual contact with somebody HIV positive, that he or she did not taking his medication, so you have open sex without protection, your chance to catch HIV is very high, because that person has seen patient with $5,000 viral load. So therefore, for you to catch HIV is easy to catch HIV in that person. But when that same person have about 10 virus per ml, so your chance to catch the infection is kind of low. People need to understand the best way to keep your viral load low down is take your medication.
Take your medications, yes.
Because your medication try to fight with the virus. If you do not take your medication, the virus has a tendency to multiply. So in order for us to explain to the patient, you need to, your best bet in HIV is to try hard to keep your HIV below what it is, below 50, below 20. In order to do that, you must take your medication, otherwise it won't happen. So we need to explain to people the best way to survive HIV, the best way to claim victory at HIV is to take
your medication.
Correct.
And that's what I said in my podcast when I was talking about HIV. You have patients with the monster virus, meaning that they're not taking their medications, they're not responding to the medications because they're not taking their medications. And that's what we used to call the monster virus. And the patients that were taking their medications with the viral load down, we call that like a cat virus, how we would explain it. So thank you for that. Now the next thing I would like to ask you is about, I didn't know that you were doing diabetes.
Yes.
Could you please explain the medications and the services that you all provide at your doctor's office? And please give them the address to your doctor's office and all that information.
Okay. The thing is this. Diabetes is one of it's a very nasty disease, because diabetes is a multi-organ disease. It affects your eyes, your kidney, your heart, everything.
Every major organ.
So in fact, 25. This is an exam question. 25% of people on that disease is due to diabetes. 25%. Those who are receiving dialysis treatment, and whereas 20% are diagnosed with hypertension. Since when a diabetic after a certain year, once you're diabetic, subsequently, automatically you become hyperlipidemia, definitely. And that 100% will become hyperlipidemia, and 80% will become will diagnose hypertension. Since diabetes alone will send 25 people who are on dialysis are due to diabetes, and 20% of them are due to hypertension. When you combine somebody with diabetes and hypertension, that person has 45% chance to be on dialysis. Apart from the diabetes and hypertension, and 25% from diabetes, 20% from hypertension. There is the catch. Why so many people become very sick with diabetes?
And I've noticed that it's
is because
of color.
Or color, yeah. Well, people's color because there's disparity. They have less access to medical care that happen.
Yes,
To,
please,
to,
please talk about
to,
that.
to medical care. The problem is we need to educate our sisters and brothers to go to see they have certain culture. If I don't sick, if I feel good, I don't need to see a doctor. That's the problem. People tend to believe even though they have, and that happened basically from the Caribbean third world country is an economical problem, and they're saying that some people here they have 4 or 5 kids, they are hardly get a good job, so they don't feel like if I'm not sick, if I don't feel anything wrong with me, why should I go to see a doctor, pay him $100 a visit? Why should I pay $60 a visit? I might as well go to supermarket and buy food because I'm not sick, I feel good. But they don't know that. The best way I explain to my patient why you should go to doctor. I say, what type of car do you like? Give me any car, Mercedes, BMW, Toyota, Ford, Chevy, I don't care. Let's say for I give you bring BMW 224 and you live in Palm Beach County, but your job is in Miami. All you have to do, drive your car to Miami, just put gas, just keep on driving your car, going to Miami, come back. And you never check your oil, anything. So how long that car will last?
Not long.
Same thing.
Because the bloodline is the
I said, you are the BMW. You are the BMW. All you do is eat, sleep, eat, sleep, eat, sleep, eat, sleep. You never check your blood. You never check urine, anything. If a woman never had mammogram, anything like that, so you never check anything in you, anything. You think you're gonna live longer? You're gonna live 100 years, 50? No way. You're gonna die quick because you fail to identify certain problem that you may have. Then we can correct. Same thing like you've been. So what I explain to my patient, the biggest problem in diabetes is because we do not. Some physicians, some patients do not know what you call pre-diabetes. Because before you become diabetic, you were at some point pre-diabetes, and that's why people need to know. If you pre-diabetes, we catch it early, we can prevent, we can delay for you to become diabetic, maybe next 15, 20 years. What's pre-diabetic is? That's what you need to know. What pre-diabetic is. Pre-diabetic is the step before diabetes. No, the normal blood sugar is about 60 to 99, to less than 100, not to 99. So if your blood sugar is above 99, is above 100, you have hyperglycemia, but at the same time you're pre-diabetic, because if, well, some books said above 100 can be 101, 102, but basically speaking, as far as I'm concerned, but if your blood sugar, fasting blood sugar, it's not in one occasion though, two things we can take into consideration, because so many things can increase your blood sugar slightly. That doesn't mean you're pre-diabetic. However, if consistently on 3 occasions, your blood sugar is slightly above 100, 102, 103, 105, you're pre-diabetic. But there's another way we also diagnose pre-diabetic, is based on hemoglobin A1C. If your hemoglobin A1C is more than 5.7 to 6, you pre-diabetic. It's more than 5.7, going 5.9, you pre-diabetic. So the normal hemoglobin A1C is below 5.7. Now, if you pre-diabetic, there are 2 schools of thought, meaning that if you pre-diabetic, there's so many things I can do for you. I can, depend if you're obese, I can have you lose weight, change your diet, exercising, then I may not to give you anything. Because if you obese, you lose weight, you control your diet, do exercise. People don't ask me, why do I do exercise? What should I exercise if I'm diabetic? Because when you do exercise, you produce heat in your body. That heat burns the sugar for you. In fact, this is the exam question again. If you have a patient taking insulin, and that person is exercising, at some point you will decrease the insulin because you will become hypoglycemic. So exercise do help you in control blood sugar because it helps you to metabolize your blood sugar. So therefore, we have two school of thought. One school of thought said, if what I can treat you with medicine, with pharmacology therapy, I also can treat you without pharmacology therapy. What are the people we treat without medication? For instance, if you do not have family history of diabetes, if you do not have high blood pressure, if your cholesterol is okay, you slightly overweight, I can manage you with exercise, diet, thing like that. But if your family history is positive for diabetes, I tend to be more aggressive with you. These are the people we can manage with certain type of medication. And as we speak, one of the best medications that we use for that is metformin. Patients who are pre-diabetic. So we can give metformin. We do not give metformin to every single patient. Now, if there is no contraindication, metformin is the best drug we use for pre-diabetic to patients who have high risk factors, like your mother was diabetic or she's diabetic, and you have hypertension, because remember, I'm telling you, people who are diabetic, 80% would have high blood pressure, 100% will have trouble with lipids. So therefore, these people, we try to be more aggressive. It's because we fail to identify pre-diabetic. That's when they become diabetic. The last thing, when you go to say doctor, because of symptom of diabetes, you lost 40% of your pancreas. Your pancreas is the organ that produces secretly insulin for help you metabolize your blood sugar. If you wait until you have symptoms, losing weight, you polyuria, you pee every 10-20 minutes after thirst. Yes. If you wait in that stage, you lost half of your pancreas already.
Oh my God.
Because you can be diabetic for 4 years, you never know about it. Because for you to stop urinate a lot, your blood sugar must be above 200, at least 180. Somebody with blood sugar 140 is diabetic, but you're not going to urinate thirsty at 140. No. Because if you were to notice your symptom, you're losing weight, you're thirsty, blah, 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 that's when your pancreas is gone 50%. Meaning that if we catch you early, you
can prevent it.
Oh, definitely. Definitely. So we need to talk, we need to expand to our brothers and sisters who are maybe mostly victimized the most with diabetes. Like you say, we see black people have a tendency to be more diabetic than those with more diabetes than what counterpart. Also because of, like I said, economical reason, because of financial burning and disparity, they have goes on to go to seek medical care. But if you go to the doctor, you should check your blood once a year.
Yes.
Even though you're not sick, you don't do anything, you should check your blood once a year. If you check your blood once a year, and the blood test, if you go to Quest, in an office, it says if you do blood test, we will know 70% of your problem. If I'm looking at somebody, how do I know you diabetic? How do I know you have high cholesterol? Give me some blood, I will tell you. Somebody will tell you. Exactly. So the best thing to do a complete blood test every year. Trust me.
CBC with this and all.
CBC with this lipid panel, UA analysis, UA sample, lipids panel. Then. Yeah, vitamin D, because most black people are, not black people only, but by the way, patients who die from COVID, most of them, there was a study shows most of them have vitamin D deficiency. So I suggest everybody to do vitamin D level. So these are the tests that we do. Check your vitamin D, check your THC, your thyroid, your liver, everything. Once a year you can do that, once a year. What's the big deal? And you'll be surprised how many people can save by doing just that. Yes. One blood test, one TB, that's it. Just a simple blood test once a year. That means that when you take your BM to the garage, when it's for maintenance, or you instead of bleeding, since you are the BMW, you are the Mercedes-Benz, you are the Toyota, if you want to take your car to the dealer for maintenance, that's what you have to do.
That's
Take
right.
your blood.
That's right. That's
Check
right.
your blood.
So with that being said, everybody, I gotta have you back because this is so interesting, Dr. Alexander. But I thank you for coming. But could you just tell people in Creole, your language, where they can find you, and also will you can say it in English as well. So
Well,
we're gonna close out with that.
Well, listen, the best way they can find me is call me my cell phone because I'm kind of half and a half. You can call me at 561-613-5450, 561 613 54 55, 613 54 50, 561 613 5450.
Multi-talented.
Yes.
Thank you so much for coming. I gotta have you back. I
Well,
am blown
it's
away.
pleasure.
And see, people don't know that. Well, people who know me from Delaware, they know that I worked for the health department for 15 years. But my mother was a retired RN, and she died of diabetes. So this means so much to me. But remember that February is Black History Month. Thank you so much. So good to see you.
The pleasure is mine.
Dr. Serge Alexander. You know how to get in touch with him. We covered HIV and we
Diabetes.
covered diabetes.
561-613-5450.
You got it.
Thank
We
you.
love you guys. Have a blessed one. Again,
Take care.
thank you.